Will the province reveal vaccination rates in individual care homes? If there is 5% of the workforce unvaccinated, is there a place where those numbers are higher than others?
By health authority, the answer is yes, and provided the sort of preliminary numbers this week, but those numbers continue to be the case. In terms of assisted living, it's pretty stable across the province, so 95% in Interior Health, 96% in Fraser Health, 99% in Vancouver Coastal Health, 97% on Vancouver Island, and 94% in Northern Health. Obviously, there are fewer overall numbers in assisted living across the province. There's 7,789 staff reporting. In the more significant area, which is long-term care, number is 94% in Interior Health, 97% in Fraser Health, 98% in Vancouver Coastal Health, 95% in Vancouver Island Health, and 89% in Northern Health. And those are the first dose numbers across the province by health authority. I think it's fair to say a very small number of care homes. I think the number, if you look at all care homes with more than 10 employees, I think it's 4 or 5 that are under 85%. And we've gone through plans through care home by care home to ensure that we're ready for especially this first week of transition, because these are the first shifts where the provincial health order will be in effect, and people who are not yet vaccinated will be entirely excluded starting today. So there is differences between care homes. As you can see, the numbers are very high everywhere and significantly higher than they were a while ago. It's our obvious hope that we're going to continue to make even more progress this week. There's been very significant preparations for this in the Northern Health Authority, for example, where we've provided additional supports to certain care homes already to ensure that they're able to maintain the high quality of care you'd expect. I might add that we've added thousands of care workers in the last period across long-term care in BC, and that also supports us as well, and we're going to continue to look to that. Well, look, regardless of all of that, regardless of the fact that some of the significant number of the care home staff who are not yet vaccinated are casual, and its effect isn't, and the vaccination rate is very high at 96% in long-term care, 97% in assisted living. There is no question that this represents a challenge for us, and we are fully mobilized to the task of supporting care homes and making sure that for residents in long-term care, they continue to get the support they need.
Did you have a follow-up?
Yes, I do. I'm wondering if there are some care homes are struggling with staffing. We were told by the ministry staff last week that the government will allocate resources as needed if some regions are going to face a major staffing shortage. Could you please elaborate on how is this going to work? Like, where will these resources or workers come from?
Well, this has happened from the beginning of the pandemic. It obviously particularly happened in Wave 2, and in the case of some care homes, I think the Little Mountain Care Home, I believe it was around 90 care staff from Vancouver Coastal Health went in to support that, including at the time a vice president who went in to work there every day at Vancouver Coastal Health, and we are going to continue to do that. So those resources in those care homes that are there's a relatively small number of care homes that require such support. We're going to seek all of the means we have, and that will include moving and adding care staff to support care homes that are seeing a significant number of unvaccinated people. But overall, I'd say we're pleased with the number we're at right now. We're pleased that we're at 96+% in long-term care, 97+%, or 96%, 97% in assisted living. So overall, at a significantly high level. But we'd much rather be at 100%. And we're going to, yes, in some cases, should that be required, add resources to sustain care homes, especially the small number of care homes that are significantly below that. And that's, I would say, about 4 care homes across the province that are below the 85% mark, for example. Those have already received some support, but others who are going to face some challenges in the coming weeks, because this is in spite of the 96% and the 97% numbers, still a significant challenge at a time when healthcare is being challenged everywhere. And we're also preparing, of course, for the significantly larger challenge in terms of sheer numbers of workers, almost 3 times the number of workers who are still to come in the broader mandate for all healthcare workers that Dr. Henry and the Provincial Health Office have put into place, and that work is ongoing right now, and that will be, in terms of sheer volume of change, an even more significant challenge.